Welcome everybody, and I'm here to show you some stuff in FormCentral. It is, since this is a user group meeting, it is, I'm kind of taking an assumption that you're already existing users of the Magic software. If you're not and you have Magic, I would suggest you take a look at some of the features that we have, although these are just add-ons, best practice kind of things that I'm going to be showing today. So if you wanted a more in-depth review of what the Magic software can do, please go ahead and give us a call and we can get that straightened out for you on a more personal level. FormCentral is written in Magic. It exists on your Magic platform. We open directly to your Meditech database in a read-only function. This features, this gives us the ability to do things that no other vendor, including our own fast print software, can emulate or even come close to comparing to. Some of the things that make us so powerful because of our integration are the ability to interact with the features that Meditech already has. Everybody's used to the certain types of keystrokes and functionalities that the Meditech Magic product brings to the table. We use those as our strengths so that you don't have to end up training other people how to use those things. One of the greatest assets of our software is how easy it is to roll out to your end users because they're not seeing anything that they've never seen before. They feel very comfortable with it, and it's very easy to go ahead and do the things that they need to do. Meditech has created a technology called customer-defined screen technology, which is a huge asset to all the hospitals that utilize it. Customer-defined screens allow hospitals to capture data that the Meditech system is not going to capture for them. Everyone knows that Meditech is going to capture name, date, age, sex, things like that. But there's always important information that each individual hospital needs to collect, either it's local, state regulations, or just based on the type of insurance plans that people have and the types of questions that they have to answer. There's information that's incredibly valuable to their organization that they can use these tools to pull into their system. We interacted with these CDSs from the get-go in two ways. The first way was a very powerful feature that I'll actually refer to later in the presentation, which allows us to generate forms, a form or a group of forms, a packet of forms, off of the answer to any customer-defined screen prompt pretty much almost anywhere within your Meditech system. If you have a question that a nurse is asking a patient on the floor about whether or not they've ever been admitted to a hospital with a MRSA infection, by answering yes to that question, a form can automatically be generated to print at the local nurse station printer, or it can be prompted to the end users for what printer they want to print that format right on the fly as it happens. And that's a very powerful feature that many of our hospitals utilize. Another way that we interact with customer-defined screen technology, the way that we have in the past, as long as they've been around, is the ability to pull in a customer-defined screen prompt from Meditech, one of their queries, and make it a keyword in our form system. So if that very important question about whether or not you've ever been admitted with a MRSA infection, if that's something that you would want to print on a form somewhere, or more importantly, use as the criteria to determine whether a form should print, we can pull that over simply and easily on a standard Meditech lookup field. You find the query, you pick it, you file it, and now you have a query on our site. So that's the technology that we've always had throughout the process. And now we've added a new feature where we really completely embrace what the customer-defined screen technologies do. And we now have the ability to, since we copy the Meditech MIS in our system, we have the ability to create keyword customer-defined screens utilizing our own keywords and queries that we want to put on them, and actually have those screens pop up and ask the question to the end user when they generate a form. And so this is an example of our test system for Formfast, and you'll see that it looks exactly like the standard Meditech test system. And you'll see that I'm going to select the customer-defined menu off of that. And then again, you'll see the standard Meditech customer-defined screen menu. And what we're interested in are these three fields: enter edit queries, enter edit group responses, and enter edit customer-defined screens. One of the more agile aspects of the customer-defined screen process is the ability to create your own tables. We see this new feature that I'm about to show you utilized in a lot of areas like triage and pre-op areas, where things are happening real time, on the fly. People need to fill out forms or provide information for someone else, but they can't do it in advance. It's not something that can be planned out. So you'll see an example here of this is a pre-op form that we're looking at, and somebody needs to be able to select which anesthesiologist is going to be doing the anesthesia for that procedure, and they never know who it's going to be before they get there. So they built this table with the anesthesiologists who might be available, and they're going to put this into a group response dictionary. And then here you'll see that we have a standard Meditech customer-defined query screen generator, and I'm just going to create a question for the anesthesia provider, and I'm going to fill it in with that group response that I just added. And again, everything that I'm showing you here at this point is standard Meditech customer-defined screen information. If anyone in your hospital has ever built a customer-defined screen, they'll be able to do everything that we've looked at so far. There's only one small difference that we have in this process, and it's incredibly small. Here is the place where we actually take all those queries and put them on the screen and build it. Again, this is exactly the same as everything Meditech does, but we have this one field here where for the type, we have FF for Formfast, and that's the only difference that you have. Up until this one prompt, every single aspect of creating a customer-defined screen is exactly the same as it is with your Meditech system. So I've gone through and I've created a group response of my anesthesiologist, and I've created a bunch of queries, including those, some generic risk factor queries and that are free text, and I've put all these queries together onto this customer-defined screen called consent. Now, before I show you how it's actually used, I'm going to show you a new routine that we have on our dictionary menu here. It's right under the same routine that, it's very similar to the routine that we already used that I mentioned earlier, which allows us to copy a Meditech customer-defined screen query into a keyword for our system. This new routine, copy MIS screen to keyword, will do the same thing, except it'll do it to the screen that we just created. So if I select this routine, I'll get a lookup. And in this lookup, I'll get a listing of all the customer-defined screens that exist only in my Formfast test database. Again, we don't ever interact with your Meditech database in this respect. So these forms all exist, these customer-defined screens all exist within my system. So the one I just created was consent, so I select that one, and then I file it. And what's going to do, it's going to create a keyword for every query that I created onto that screen. So if I went into the list keywords routine, which is this is what a screenshot of right here, you'll see that just like the Meditech NPR report writer list data elements routine, I can get the actual physical structure of the files that I have here. But you'll see that these risk fields, these were queries that I created for that screen. And now they're all sitting here listed as field categories in our list keywords routine. Now, in the Enter Edit Form dictionary, there's a new field called screen. And if I do a lookup and selected consent for this particular form, and then what happens when this form is called now, this screen will pop up and ask for data to be printed from it. And what I've done here is I've taken some of the keywords that I just recently created from that customer-defined screen field. And again, this is a completely non-technical procedure. Okay, I created the screens through the Meditech routines that I've always created them before. Then I just selected that screen and filed it, and it went through and did all the technical work of creating these keywords for me. But I was able to take these keywords and put them onto the form. You can't see it on this screenshot, but the anesthesia provider group response is printing lower on the form. So here I selected which screen I want to select the data from, and then I put these keywords on here, which will be completely blank if they're not filled in onto that form. But if they are filled in, the data will appear here where I want it to appear. Okay, and if I were to go ahead and go to print the form, before the output actually started printing, obviously, it would come up and ask me these questions. The magic and the wonder of customer-defined screens is in that I can force the end user to answer them. I can make these prompts required, and I can make sure that they have to be answered so that these forms will never be forwarded on to where they need to go without the data filled in. More importantly, I can control how the data is entered. Here as an anesthesia provider, I force them to put one of the 4 or 5 doctors that I have in there as a solution. They can't choose anything else. So there's no incorrect data that's ever going to be entered on a form. And I'm also eliminating handwriting from the conversation. Okay, sometimes things can get scribbled, especially in an ER environment or a pre-op environment. There's going to be a lot of stuff going on, and this allows you to remove handwriting. So you remove handwriting problems, data missing problems, and correct type of data. If you want a date field filled in as a date field, you know that the customer-defined screen will force them to enter it as a date. So all that being said, we're able to generate this form for our end users with the data that they have input right there at the spot. Now, currently, the existing version of our software, this data does not store permanently, so there's no HIPAA or encryption issues that we need to worry about. It is the #1 enhancement we have going forward for our next release, to make that an option to save the data, and then what we were going to do is verify that it was the way we store the data, it would be HIPAA compliant, and then we're going to get that rolled out for the next release. But right now, it is a fill it in, print it out, and the idea behind the people that are currently using this product is the form is going to get physically scanned into the medical record or physically put into the folder of the medical record anyway, so it doesn't matter that the data is stored permanently. It's just like if the form is filled out by hand, except you remove all the error and the neatness issues. So that's what we have for the customer-defined screen technology. It's a new feature that we have, and we're excited about the things that people are using it for, finding new uses, new places for the software. Next is just a very quick feature. It'll only take a moment to go over. And basically, we have a lot of hospitals now that are using our software with hundreds and hundreds and hundreds of forms and packets. And sometimes, even with the ability to cut down the amount of packets that an end user has available through the category field, and even being able to consolidate packets now, because we have a feature that allows you to put criteria into the forms within a packet. So instead of having to have a form that's 6 forms and then a separate copy of that form, that one of them is different because the patient is not an adult, instead of having 2 packets now because of that one form difference, you can put all those forms together in a packet and use criteria to print one or the other. So even though you have all these features to reduce the number of packets, sometimes you still end up with hundreds of packets available. And so we built in a feature that isn't well documented on the screen itself. It doesn't have any kind of something up there that tells you it's there. So if it's not caught in the user manual, no one knows about it. But that is the fact that we can use an asterisk as a wildcard in the lookup screen. So here's an example of our print forms with patient data routine. And somebody gets down to the packet prompt. And if I do a lookup here for this particular test facility, you'll see that I have 5 packets available to me, and 3 of them have the word test in it. Or I'm sorry, yeah, 3 of them have the word test in it. This one has testing in upper and lowercase in the description. This one has testing all uppercase in the description. And these both have test in the mnemonic in uppercase. Okay, so if I were to go in and in the packet prompt, instead of just pressing the F9 blankly or putting in a beginning of a letter to see the packets that began with that letter, if I type star test and then press the lookup key, I'll get this as a lookup. So instead of all 5 entries, I'm just getting 3. And the 3 that I'm getting all have the word test in them. And you'll see, because of the case is different in all examples, it doesn't matter. We convert everything to uppercase and then test it that way to see if it matches. So you won't miss anything based on text. And this is the kind of feature that's been in the system for a very long time, and I'm often surprised that when I'm involved with dealing with customers and helping them support issues that they don't know this. So we thought we'd throw it in here today and let you guys know that it was a feature that was available to you. Another underutilized feature that we have in our product is the scheduling menu. This is a feature, again, that separates us from many of our competitors. Is that because we're open directly to the Meditech database, we have access to do things, and we have systems set up in place where we can set up things like scheduled forms. So here's an example of a test scenario. I can have as many schedules as I want, so I define them just like every other Meditech dictionary that's ever existed, mnemonic, active, flag, and description. So I can describe what this schedule is about, what it's doing. I can create a range of dates that I want this schedule to run for. So it's something that I had a hospital that did this with, they put together patient menus with using our overlay system, and they generated the patient menus out to the floors every day. And so what they would do is they would set this up for a month at a time, so that way they wouldn't accidentally print the incorrect menus the following month. But you can use these for all sorts of forms, and you'll see here that I select a category and a packet. So if I have multiple categories and multiple packets that I wanted to print to the same group of printers at the same time, then you can go right ahead and just set up multiple schedules. So I can determine I want to print this category and this packet to this location to this printer. And I want it to run once a month at 9 o'clock on Mondays and from this date range, and it'll do that. I can set specific days. If I set it for daily, I can set specific days here. And even though I say daily, I could say not on Wednesdays by not putting the day in here. So if you have a nurse or a secretary that gets up into an area at the beginning of her shift and promptly pulls up all the forms in that, all the patients in that location, and prints out a H&P and something else for everyone on their floor all at once. If that's an operation that's going to happen at basically the same time, at the same day, every day, you could set up a schedule where that printed out to that printer automatically, and that person would have that much less work to do. Instead of actually doing it, they just walk by the printer, pick it up, and they're good to go. So this is a feature that we see the people who use it really like it, and the people who haven't used it, you know, it's something we hope that they can explore, and another feature they can use within our system. So I see I'm hearing back now that the rest of Pam's presentation is ready to go, or the next presenter is ready to go. So I'm going to end my talk here and let Aaron.
Thanks, John. If the viewers are looking at that version, they're seeing features that they don't have, maybe they're a few versions back, remind them how they can get that update and if there's any cost involved.
Okay, as long as you're you know, current on your maintenance, updates are part of your service agreement, and I will be happy to update your software at any time. If you give us a call, send an email to techsupport@formfast.com, or call me or email me directly, and we can get that process rolling. There is no cost involved. It is part of your normal service agreement. And I would suggest that anybody who's out there that still has Magic software and uses our FormCentral product that doesn't have the most recent version, I would strongly suggest that you get it, because there are a lot of features and a lot of things that we can do with the software that your older version just won't be able to do, including some of the stuff we've seen here.